Welcome back to Today's Health. Today we're talking about advanced care planning for those with serious medical conditions. Joining me now is Pulmonary and Critical Care Specialist, Dr. Michael Basha. Dr. Basha, thank you for joining us today.
Thanks for having me back again.
Now, as a physician, why is it important for patients and family members to do advanced care planning?
Well, this is a very important part of what we do in the hospital, and as a critical care doctor working in the intensive care unit taking care of the very critically ill patients, this is a very important thing that we do on a daily basis. It's as important as, taking care of the patient in the ICU with all the various modalities and treatments that we give. Many of the patients, unfortunately, who enter the ICU don't leave the ICU. They have a serious illness or multiple illnesses. They have an advanced age. They have an overwhelming disease process. And oftentimes, despite the fact that we give them wonderful supportive care and all the available treatments, they just don't make it out of the ICU. So it's very important, really, from day one to have that conversation either with the patient, if you can have it with them, or the patient's family, so that they know exactly what is going to be happening to them and what the likely outcome might be.
Now, once all of the curative treatment options have been exhausted, what other treatment options are available?
Well, a lot of times when we realize that we're not going to be able to get the patient back to normal health or excellent health, we'll often focus on symptom relief. So we might, take care of a patient's pain or take care of a patient's shortness of breath. Some of these things are referred to as palliative care type options and so forth. So we may focus not so much on treating the patient's pneumonia, for example, or their kidney failure, for example, but rather focus on things that are related more to symptoms. And these can be, as I mentioned earlier, pain, shortness of breath, agitation, itching, and those sorts of things.
Now, what are some common health conditions that could benefit from palliative care?
Well, there's a whole variety of different medical conditions that may benefit from palliative care. Things like cancer, end-stage lung disease, and such as emphysema, HIV disease, for example, chronic kidney disease, patients who have a liver failure, patients with overwhelming infection, patients with neuromuscular disease such as Parkinson's disease, myotrophic lateral sclerosis, or Lou Gehrig's disease. There's just a whole host of different diseases that might benefit patients when they get to that point, and when the patient or the patient's family, along with the doctor, have decided that we're not really going to focus anymore on getting the patient better, but on relieving symptoms.
Now, what is the benefit to patients and caregivers of choosing palliative care as an option?
Well, again, we're moving the focus from an acute care facility such as the hospital to something other than that. We're focusing more on symptom relief and not so much on treatment of the patient's underlying condition. Towards the end, patients have a lot of issues. It can relate to such things as anxiety and depression, panic. It can be related to pain, discomfort, difficulty breathing, shortness of breath, agitation, delirium, itching, all sorts of other issues or complaints that at that point might be better treated with palliative care as opposed to actual acute treatments.
So the goal appears to be doing whatever you can to make the patient as comfortable as possible for the remainder of their lives.
That's right. So we're trying to focus on making the patient comfortable, helping the family get through a very difficult situation, most importantly focusing obviously on the patient and trying to relieve those complaints or those symptoms that the patient has. Towards the end, for example, many patients who are chronically ill or terminally or irreversibly ill don't want to eat. And oftentimes the family members are trying to force the patient to eat, and oftentimes as physicians or caregivers we have to let the family know that this is a very common thing at the end. Patients will not want to eat or drink, and we just need to allow them not to do that, because if you force them, they oftentimes will not tolerate it, they may get sick, and it's just not the right thing to do at that point. So these are things that we try to help the families along with at that point in the patient's life.
Sure. So What are some questions, as a physician, what would you recommend as questions that patients or family members could ask you so that they could be educated on this process?
Well, again, we start from day one in the ICU especially because, again, that's where we see the most sick patients. We try to let the patient and the family know, what's in store for them in the ICU. Are they going to end up on a life support machine? Will they have an induced chemical coma? Will they have large IVs placed in their body? What's their likelihood of recovery? Was there ever a discussion previously about what the patient would want if they found themselves in this situation? What's their likely hospital stay? What's the likely outcome? Will they leave the hospital? Will they end up in a nursing home? Will they end up on a life support machine for the rest of their lives? These are all very important things that we try to have discussions with right from the beginning so that patients and families know, what to expect.
Dr. Basha, this has been great information. Do you have any closing comments for our viewers?
Yes, I think what I'd like to say, what the most important thing is that these are very important discussions that patients and patients' families should have with their primary care physician early on. So like when maybe a patient gets a bad diagnosis like cancer or maybe Lou Gehrig's disease or chronic liver failure or something like that, in which they will have declining health over the next weeks or months, these discussions really need to take place with the primary care physician at that point, because many times these patients, when they are presented with their likely treatment options and so forth, they may say something like, I don't want to be on life support. I would prefer just to be made comfortable if it comes to that. And these are important discussions to have in advance before something bad happens or before a serious illness develops.
Dr. Basha, thank you for joining us today.
Again, thanks for having me.
Stay with us. We'll be back after this break.